Excitement and frustration. Shall we focus on what's important for you and your school children? If I've got this right, I think your children, what's the time they could be heading out now, might not need their masks or face coverings, and of course there are other restrictions to be eased. Let's turn to someone who hopefully can give us the full briefing that we require. I speak of Health Secretary Sajid Javid, who joins me now. Good to have you on. Can you walk my listeners through exactly, I think something happens today and over the course of the next 7 days. Good morning to you.
Yeah, good morning. And you're right in what you just said. And that's because today marks the next chapter in our fight against COVID-19 as we return to Plan A. And you'll recall, Nick, that when we first learned about Omicron, we said we needed to buy time. That was the purpose of Plan B, time to build our defences. And that's exactly what the country has been doing, especially with the booster programme. Some 15 million people across the UK came forward. They answered that call. We are now the most boosted country in Europe. And as a result of that and other actions, we can return to Plan A. And what that means specifically is that the government is no longer encouraging people to work from home. And from Thursday next week, there will be no mandatory requirement for face masks or for the NHS COVID pass. And actually, that's earlier to action tomorrow and today in schools, which is that no need to have face coverings in classrooms. And then again, Nick, I can't stress enough, the reason we've been able to do this is, and it's all supported by the data, is because of the vaccination program and how people have come forward. And if there are people listening that still have not had their first, their second, or their booster jab, please do come forward and protect yourselves, protect your community, and help the whole country to learn to live with COVID.
Secretary of State, if the battle against COVID was a brutal, ugly, and sometimes distressing rugby match, are we reaching the end of the game? Are we halfway through? We're all missing JVT, Sajid. Mr. Javid, you can see this now. Are we halfway through the second half? Are we coming towards the end of the 80 minutes? Where are we in your view, Secretary of State?
Well, in my view, I think over the last couple of years, we have learned a lot, and we have huge defences. There's the vaccines that we know are working, and they work not with 2 jabs now. With Omicron, you need your 3 jabs. We have antivirals and other treatments, and this country has purchased more antivirals per head than any other country in Europe. And we have a huge testing infrastructure. This month alone, we've planned for some 400 million lateral flow tests to be distributed around the country. That's more than any other country per head in Europe. And it's because of these defences we're starting to learn to live with COVID. But if you're asking me, does COVID ever sort of go away? Do we reach the end of the road? I'm afraid not. I think COVID is here to stay. But I am confident, in fact, I'm very confident that we will learn to live with it in the same way we have learned to live with other viruses such as flu.
Do you imagine then, because you'll be aware many of my listeners express frustration at trying to see their doctors face to face, does this mean that there will hopefully be a return to more face-to-face appointments with our GPs, Secretary of State?
Yes, it does. Look, I think everyone understands that during the height of the pandemic, especially when it started and we didn't have all the defences we have today, that GPs, they couldn't meet people in the usual way when we had all those social distancing restrictions in place. And we were starting to see a big increase in face-to-face over the last few months, and that came to a halt because of Omicron, because we rightly asked GPs to refocus their efforts on getting people, especially vulnerable people, those in care homes, those that are homebound, vaccinated. Now, as we are moving back to Plan A, I think GPs will find that some of their time will be freed up because they don't have to focus so much on the boosters, and we will start seeing more face-to-face.
You earlier referenced, and I fully endorse what you say, the need to get vaccinations. As regards NHS staff, it is reported that some staff could lose their jobs within the next few weeks if they decline to have vaccinations, unless, of course, they have medical reasons. Former Health Secretary Andy Burnham was on this show yesterday. He was critical of that policy. Are you sticking with it, Secretary of State?
Well, yes, we are, and Andy Burnham will know that there's a cross-party agreement on this. When the policy went through Parliament, it was overwhelmingly supported by members of Parliament across the House, and the reason is because it's about patient safety. You're the people in hospitals. If you're sadly admitted to hospital, you are amongst the most vulnerable people in the country. You're already there for a very important reason. You're suffering, and it is right that the people that are looking after you are professionally responsible to make sure that the risk to you from any infection that they might have is minimized. And thankfully, since we announced this policy, the number of people in the NHS that have had at least one vaccination has risen from something like 91% to 94.5%, and it's heading in the right direction. And we will continue to work with those that are still unvaccinated in the NHS to help them make this positive decision to protect themselves, but also their patients.
But ultimately, a nurse, a doctor, or whatever it might be, might lose his or her job.
Ultimately, anyone working in the NHS in a frontline job will have to get vaccinated. If they choose to not get vaccinated, that is a choice for them, but they will have to know that they are not meeting the requirements to be employed.
But this is at a time when I understand there are a shortage of nurses and other posts. We might be letting some go. How wise might that be?
Well, again, this is how wise would it be to not do everything we can to limit the transmission of COVID in hospitals. Nick, I can tell you that if we look at those people in hospital today in England with COVID-19, we estimate it's around 15,500. That around 40% of them, they're not in hospital because they're suffering from COVID. They're in hospital for some other reason, but they happen to also have COVID. Now, many of them would have caught COVID in hospitals, and that can't be right either. They're already ill. They're already suffering. So it is a professional duty of a health worker to limit infection. The GMC, that's the General Medical Council, they already require, even before the world had heard of COVID, they already require doctors, for example, to be inoculated against some 7 diseases, I think. And that's never been an issue. Why should it be any different with COVID?
Last couple of questions, and obviously the benefit of having someone as senior in the government as you, I can't let you go with asking a question. It would appear that the simmering dissent that was apparent within the Conservative ranks earlier this week, and indeed over the weekend, appears to have abated with events yesterday. Many commentators saying that. Would you concur, Mr. Javid?
I think I was, first of all, I would say I was with the Prime Minister yesterday when he was in Parliament, setting out the next steps in our fight against COVID. He was there for a couple of hours, took many questions, and there was a huge amount of support for what he said and his policies, and the fact that we are the first country in Europe to be turning and winning against Omicron. If you are also, I think you might be referring to the defection that we saw yesterday, which was one of the MPs that was formerly, I guess now, a member of the Conservatives and defected to Labour. Look, I didn't like to see that. No party does, and I like Christian. Wish him the best, but I think it's the wrong type of decision. Your constituents have voted for a Conservative back in 2019 in Bury South, and I don't think really an MP can unilaterally change that for them. MPs should remember that primarily your constituents are voting for your party and your manifesto, your mandate, your leader. They're not necessarily just voting for the individual, and it was sad to see that happen.
Were you surprised by David Davis's attack on the Prime Minister, Secretary of State?
Yes, I was. I've got a lot of respect for David, and of course I still do. I don't agree with him on what he said in Parliament yesterday, and I was surprised. Yeah, I'm not going to pretend I was sitting there expecting it, and it's up to him, of course, what he thinks. But I think the fact that the Prime Minister has come to Parliament, he's apologised, and he's been right to do that because he's recognised rightly that many people, millions of people, I would say across the country, your listeners have been angered and pained by what they've seen. I have, and they're right to be angered and pained by this, but he's apologised, but he's also said there's this investigation going on that will establish the facts, and once that investigation is complete, the Prime Minister, will come back to Parliament and respond to it and submit himself to scrutiny.
Last couple of questions. My LBC colleague Ben Kentish has a story suggesting the 1922 committee is considering halving the time MPs have to wait between no confidence votes. You'll be aware currently it's 12 months. There is a move to reduce it to 6 months. Would you support that?
Look, I don't know whether that's happening or not, or it's been suggested. I really wouldn't know. Would I support it? I don't think I should comment on it. I'll tell you why. Because it's the 1922 committee is a really good committee. It's a committee of backbench Conservative MPs, and the backbenchers decide the rules. And I don't think it would be appropriate for a frontbencher to suggest what they should or should not do.
All right. One thing you can answer. Are you more partial to a pork pie or a Scotch egg, Secretary of State?
Neither, because I don't eat pork.
Ah, of course. So the pork pie plot was never of interest to you.
You need to. If you put I'm more partial to a lamb samosa.
I haven't heard. I've heard a lot of plots and I've heard a lot of variations, but I'm not.
I think if you ask that question again to anyone, actually, you should chuck in the lamb samosa, and I bet you it wins.
You have a deal, Secretary of State, and I'm grateful for your time. Sajid Javid appearing here.
Thank you very much.
Thank you. Appearing here on LBC, where at 1 minute after 8 news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom, Conservative MPs are now said to be thinking twice about a move to oust Boris Johnson from number 10. Backbenchers are expected